the day. Hopefully you are all safe and following the precautions. Today I am going to explain about optometric low vision evaluation and its management. So let's start. The National Eye Institute defines low vision as bilateral visual impairment that is not correctable by standard glasses, contact lenses, medicine or surgery, which interferes greatly with a person's ability to perform his or her daily activities. While the Center of Medicare and Medicaid Services recognize distinct categories of low vision based on best corrected visual acuity, a much broader range of patients may also be defined as having low vision based on compromised visual fields, impaired contrast sensitivity, or other deficits in visual function. Low vision is only diagnosed when the vision in the better eye after all forms of optical, medical and surgical interventions is still very low and would therefore require a low vision aid which is designed and suited to handle that issue. A clinical low vision rehabilitation evaluation is a specialized eye exam that focuses strictly on visual function as well as prescribe aids to help maximize the use of remaining or residual vision. It should be recommended for everyone with visual impairment in collaboration with required treatment and care needed. These services are best provided by low vision specialists because whereas general eye care professional will try to maximize visual capabilities through any and every means, a low vision specialist will preferably focus on how to maximize functional vision which is most affected or needed at that moment. There are 5 steps approach that is used when evaluating and managing low vision to ensure a good to optimal result. These include understanding, effect, evaluation, prescription and follow-up. Firstly, you need to know the cause, type, severity and progression of lost vision, then establish its effect on vision and evaluate to know the amount of vision lost and the amount of vision remaining. After this, the best visual aid needed is then recommended before follow-up sessions are scheduled to a setting if the visual function or quality of life has been improved. There are 5 key areas in quality of life that low vision affects the most. They include reading, mobility, emotion, driving and recognition. Reading is a difficult vision dependent activity that is affected by low vision. It is usually worsened to impaired based on cause and its progression. Here, low vision helps to enhance ability and to improve environment, to improve and maximize reading ability. Mobility has to do with the movement. You need good to optimal vision for movement to safe and easy movement. However, due to reduction in this necessity, it may lead to an increased risk of fall and slip. Driving is a boost or necessity for performing daily tasks that requires an all-round optimal vision. Any defect or deficiency in the vision needing area, if not properly handled, has its potential effects or consequences. Any negative effect in this area can lead to accidents. Emotion is a very important part of psychology. It deals with the manner and reaction we display towards activity or events by means of facial expression, gesture or behavior. Low vision tends to affect emotion with extent of effect being determined by type or severity of the causative disease. This eventually causes anxiety and depression in the long run, especially in case of little to no improvement. There is need for an integration of mental health services with low vision rehabilitation if a positive improvement of emotion is desired. Recognition has to do with identifying face or facial expression. This is also an important part of person's quality of life, which can be affected by low vision. This tends to interfere mostly with social interaction or relationship, and then it affects emotion. It is essential to make sure that the 5 steps approach is used and 5 key areas are improved upon and preserved when rendering low vision and rehabilitative services. Few people are totally with sight, since most people diagnosed or categorized as blind actually have some residual vision left and therefore fall into the low vision category. But thanks to the low vision rehab, it speeds and advances. Many of them can improve their vision and hence improve the quality of life. This is future optometrist Ikra Fatma, proud to be a part of this optometric fraternity, as well as a proudly dedicated executive member of Optography. If you are new here, don't forget to subscribe and press the bell icon of this educational channel. And if you have any queries, please feel free to share in the comment section. Thank you everyone.